The following is a special presentation of Tony Curry Radio. From hot dogs to cool kitties, this is Darkside of the Pooch.
Dr. Rab, what you got? Give me some licking. I gave you. I think you're too close to your microphone. That sounded kind of strange.
I was licking the microphone.
Oh, you were licking the microphone. That's probably not a good thing to do. Dr. Rab Stewart, Rossbridge Animal Hospital. He is the proud owner, the president, the surgeon. He is super busy, but he's all part of Darkside of the Pooch, brought to you by Ed's Pet World, 47-year family-owned business right there in beautiful Homewood, Alabama, specializing in exotic pets. I saw me an alligator today, a Cayman alligator today. They've got red-tailed boas, lizards, geckos, tarantulas, chameleons, bearded dragons, birds, parakeets, whatever, and they'll do everything they can to make sure that not only your exotic pet is healthy, but also what you need to do to keep it healthy. And, of course, Seth is also all over the place. I think he's in Las Vegas right now for some toy thing he's got going on. They do all kinds of exotic toys as well. Those childhood collections are worth money. Buy, sell, and trade. Do it at Ed's Pet World. The number is 879-1331, 879-1331. Proud sponsor of Darkside of the Pooch. Okay, so it's been a couple of weeks. Our email people are freaking out because they want to hear some new shows, so they'll get this one today. How you been? I know you've been in surgery a lot. What's been going on in the world at Rossbridge Animal Hospital?
We just got, a ton of stuff going on. And, a lot of times we're recording on a day where I'm in surgery that morning. And, surgery can, I tell people all the time, like, veterinary medicine is not an exact science. And sometimes you don't really know what you're going to get until you get in there and start doing surgery. So the other day we had a dog that had some bladder stones. And those are stones that they're, people get kidney stones. So a lot of times when I talk about bladder stones, people they don't really listen to what I say. And they think, oh, well, it's like what people get.
Yeah.
Well, it's not what people get, because these stones are not in the kidney. They're in the bladder. The kidney is connected to the bladder by some tiny tubes called ureters. People develop kidney stones frequently, and dogs can develop kidney stones, but that's much less common.
Are they painful? Are they painful just like they are for humans?
Yeah, they're painful.
Yeah.
So they develop these stones because their urine is a certain pH. Instead of it being at an optimal, slightly acidic, it might be very basic, or it might be very acidic. And urinary tract infections can also lead to bladder stones, or if pets have like a little polyp or something, anything in there that might take away from the smoothness of the inside of the bladder, that can lead to bladder stones.
Wow.
So it's more common you see bladder stones in smaller dogs, small breed dogs, not smaller in size, but small breed dogs than large breed dogs. And male dogs, getting those stones out is much more difficult than in female dogs, because in male dogs you have to deal with a very long, very narrow urethra, and the urethra is what connects the bladder to the end of the penis. So yesterday we had a dog that had a couple of bladder stones, and one of them was in the bladder, but then the other one kept rolling around, and it was just big enough to leave the bladder and get into the urethra, but it was too big for the dog to urinate it out, because they can pass these stones if they're small enough.
That is
crazy.
But
when you have a stone that kind of pops in and out of the bladder, you have to use, and the dog is anesthetized for this because we're in the middle of surgery. So the dog's anesthetized, so they're not in any pain. But so you have to pass a catheter up the urethra and then try to flush it with sterile fluid back into the bladder, where you can remove it more easily. So you can also make an incision into the penis at a couple different spots should you need to. You can do it where the penis leaves the abdomen and is, around the prepuce, or you can also do it like on the dog's hindquarters right below its butt. Those are the two ways that you can access the urethra, but it's a lot messier of a surgery. So you try to flush the stone through the urethra back into the bladder where it's easier to remove. And so yesterday we had this stone that we'd flush it back into the bladder, and then we'd get in there and we'd try to get it out, and the joker would roll back down in the urethra. So it's just tough work to get it out. So, a lot of these times, especially in a female, it's much easier because the urethra is shorter. But in males, it's a lot harder, and the surgery can take anywhere from 30 minutes to 2 hours.
Wow. So
yesterday we had a long one.
What's at a rehabilitation timetable for a surgery like that for an animal?
They bounce back really fast.
Yeah.
So it depends. Everything depends on how the surgery goes. So yesterday we left the urinary catheter in so that the inflammation would have time to go away. So, if you remove the urinary catheter, if there's a lot of inflammation in the urethra, then the urethra might be swollen and they won't be able to pass urine as well. So we leave the urinary catheter in, we give them some medication to get rid of the inflammation. So that way, when we pull that urinary catheter the next day, they've got a nice patent tube to pee out of.
Nice.
So this dog's going to stay for a couple of days, be on some medication to be sure that he's doing good before he goes home.
There you go. That's the kind of work he does. And so whenever you need to take some time off and skip a show to take care of your pooches, your hot dogs and cool kitties, man, you get it done. Dr. Rab Stewart, Rossbridge Animal Hospital, 208-0301, 208-0301, area code 205. You're outside the town, at Rossbridge Vet on Twitter, and, of course, the Rossbridge Animal Hospital on Facebook as well. And it's brought to you by Ed's Pet World. All right, so we usually do a lot of mutt mail. I've got one particular email I want to get into because it's something that actually happened at my house. It's from Jessica in Del Rey, California. She was asking, she's got an outdoor cat. She brings it in when it gets a little chilly at night, but for the most part, the cat stays outside. And her cat's been acting kind of strange, kind of banged up. It's getting scratched a little bit. And she's wondering if there's any predators that she needs to worry about her cat. And I will bring up a couple of weeks ago, we got home from dinner and there was a possum eating my cat food on my front porch. The cat, Happy Jumpy Cat, was sitting right next to it, and there was nothing going on. It was like they were buddies. They were actually nosing each other. The cat was jumping over the top of the possum. The possum wasn't attacking or anything. But ever since that incident, my cat seems like it's been really, really lazy and losing weight. Is there a reason I need to worry about that? Talk about some predators, animals that cats should stay away from in the wild.
The most likely thing that's going to happen is another cat, believe it or not.
Okay.
Cats, they come across other cats and they get in little tussles, and they can pass viruses, either upper respiratory viruses back and forth, or things that are even more serious, like feline infectious viremia, also known as feline AIDS, or feline leukemia. Feline leukemia is in a roundabout way, it's a type of contagious, quote unquote, cancer. So people are familiar with leukemia. It's a type of cancer that people get. Well, in cats, it's like a virus, but it acts the same way as the cancer would. So it's not really cancer; it's virus, but it acts the same way. So those are things that can kind of pass back and forth to cats. But I mean, any predator that's out there can have a cat for a meal. But cats are pretty fast, and they're pretty agile, so they can avoid that kind of stuff. But coyotes will get a cat. I've never heard of a possum getting a cat because, most cats are about that big, if not bigger, and probably a little faster. Probably the biggest predator for cats, and it's not so much a predator, it's just more of an adversary, or other cats.
Yeah, let me ask you this, because I was surprised that our dog certainly would have chased it off, or at least he would have tried. I don't know if the possum would have moved because it looked like it really didn't care. It sat there for 2 hours. And I was a little surprised the cat wasn't getting after it. But based on its size, I mean, I've seen some big squirrels in my yard, and my cat's like, I'm not going there. It looks too large to me. Do they base their chase on how the animal moves, on the size of that animal? I know it'll pick up moles or lizards or smaller things any day of the week, but what prompts a cat to go after something?
I don't think it really has to do with size. I think it really has to do with the demeanor of the cat, if the cat feels threatened, or if the cat is losing a resource that it feels like it should not be losing. So, like food. that's something that a cat is going to fight over for sure. And I don't really think it matters the size of its opponent. You know, I mean, cats will chase a dog through the house all day long, and the dog might weigh 80 pounds. The cat might weigh 10. So, you know, I think that cats are really smart, and they're going to pick their battle, but they'll do some David and Goliath if the price is worth paying for.
Wow, I love that, man. That's great. They do have the 9 lives to deal with. He's Dr. Rab Stewart, the Rossbridge Animal Hospital. The number is 205-208-0301. Well worth the drive wherever you're coming for. The Rossbridge Animal Hospital, they're fantastic. Rossbridge Animal Hospital on Facebook and Rossbridge Vet on Twitter. And, of course, we run the show every single Monday. Make sure you go to Spotify, search Tony Curry Radio, Curry with a K, search Tony Curry Radio, and you can see all of our Darkside of the Pooch episodes. People are listening to them, binge listening to them. It's great. And there's a bunch of them up there, so check that out. It is Darkside of the Pooch. Bob in Floyd Knobs, Indiana. I know exactly where that is, right down the river there from Jeffersonville, Indiana. I used to make trips down there. Was wondering about whether there was an uptick in overdoses for dogs on weed. And it's interesting, because I think I sent this article to you. More than 200 veterinarians were polled just a few months ago and asked them to recall such patients prior to 2018. And basically there was zip as far as in dogs overdosing on edible weed products. And now that things are becoming more available, and I believe that half the states, or at least 30 of them in the United States, now allow marijuana, at least medicinal and sometimes recreational. Have you had any overdoses at Rossbridge Animal Hospital, and what would be some of the symptoms of that?
I don't have any that I know of. I've had in my career.
Want any of your customers to let you know?
Yeah. I think in my career, I've had maybe 2 people, and it's been years since these, but I think I've had 2 people that have come to me and said, "Hey, my dog got into my weed."
Yeah.
You know?
Okay.
So, you know, they get really hyper excitable. Which is kind of the opposite, you know, of what you would think would happen. But it can cause neurological problems. But I mean, I'm not surprised that it's on the rise. And maybe the reason that we still don't see a lot is because, you know, we're in good old Alabama.
It's not legal here, yeah.
You know, we're fighting it hard. So probably in Oregon, Colorado, and California, they probably see a lot more. But you know, maybe we see it. I mean, because we see pets with similar symptoms.
Yeah.
But you know, there's a lot of things that can cause those kind of symptoms.
And again, because the majority of people, at least the people that are trying them for the first time, are doing the edibles. Obviously, dogs will eat anything, and so that's certainly something you don't see a dog rolling a joint, but you can certainly see them get into your brownies. This is Darkside the Pooch with Dr. Rab Stewart here. We do it every Monday. It is Darkside the Pooch Mondays here at noon and 8. You can hear the show live every single Monday, and again on Spotify. Just search Tony Curry Radio, and you'll see a big pooch there of my blue heeler for Darkside the Pooch. I love that. Jamie, our producer here, is wanting to get a dog. And he's talking about getting an Australian Shepherd. And I said, Lord Almighty, do not do it. You do not need an Australian Shepherd. First of all, he's got 3 cats here. And I said, that is not going to mix even an Australian Shepherd puppy, because they like to corral and they like to run. I said, you want to get something that's a little more docile. He mentioned, is it a Samoyed or a Samoyed? How do you say it?
Samoyed.
Samoyed. So it's a little bit of both.
Yeah, Samoyed.
All right, Samoyed.
Yeah.
So he wants to know, what is the checklist from finding a breeder to getting shots? If you're out there looking for a brand new dog, the first thing you do, obviously, is you want to find a dog that kind of fits your personality. You want to know how often you're able to walk it, keep it out. Is it an inside dog? Is it an outside dog? Is it a hunting dog? This, that, and the other. And then you take it from there. As far as in trying to find a breeder, where do you look? What do you do with shots? Tell us all about it.
Yeah, I think you want to get a dog that fits your lifestyle more than anything. You don't want to get a dog that has a lot of energy if you live in a small place or you don't have the time to let it run around and play. So you don't want a German Shepherd. You don't want a Pointer. You know, you don't want a Weimaraner, you know, all the like Australian Shepherd. You don't want these dogs that need tons of energy outlets if you don't have a way to do that. You know, get a Cavalier if you want a dog just to be like a couch buddy. those are dogs that are great dogs, and they're really they're chill, and they just like to hang around. I mean, they've got energy too, but it's not so crazy that it's got to go on 5-mile walks every day. So pick it according to your lifestyle, and then you got to decide if you want a young dog or if you want an old dog. Some people don't like the young dog phase because they don't want to get up every 4 hours and let it outside. Some people want a mature dog that's already house trained. So there's rescues that can help you, if you want an older dog. Just about every breed you can think of has a rescue where they've got a lot of these breeds. And so you can go to them and find, an adult. If you want a puppy, you can, there's breeders all over the place. If you're going to use a breeder, then I would encourage people to see if you can get some references. Hey, can you put me in touch with some people that you've gotten dogs from, or people who have gotten dogs from you before? So I would do that. And then I would also see if you could, maybe see the parents, because if the parents are in good shape and in good health, then they're probably making good puppies that are healthy too.
Okay. Go ahead. Continue.
And then, after you've picked your puppy, then or even maybe before, you'll want to find a veterinarian and call them and talk to the staff and see kind of what you're going to need as far as what, the paperwork that you need to bring to the first appointment. So that way we'll know what vaccines it needs or what medications it may need. And then you're set.
A typical breeder, will they do the first set? Explain the shot protocol that goes along. I know there's parvo, there's all kinds of dog shots, but explain that. Is it normal for the breeder to take care of the first set of shots, and you always want to get the shots from the same person, right? You don't want to be getting shots from a breeder and then your second set of shots from somewhere else, or tell me how that works.
Yeah, most of the time the breeder will do the first round of vaccines, and hopefully they've done it at a veterinary practice and not just themselves, because you don't know where they got the vaccine or how the vaccine was stored and that sort of thing. Mm-hmm. So most of the time they'll have the first round of vaccines done. Very rarely will they have the second round of vaccines done. But most of the time the first one's done.
And what timetable are we looking at? When do they get their first set of shots or second shots? How's that work?
The first round is when they're about 6 weeks old. And then their next round is 3 weeks later. And then the next round is 3 weeks after that. And then they've got 2 more rounds after that that are spaced 4 weeks apart. Okay. And that's our protocol. Like, everybody's going to be a little bit different. But the vaccines that they need during that time, you hear a lot about, DA, PPV, or, DHPP. And that's just kind of, medical. It's a medical term for a distemper parvo vaccine. But that vaccine also has other things in it, like parainfluenza and adenovirus. And sometimes that will also come with leptospirosis. So those viruses, some are GI viruses, some are respiratory viruses, some are things that can hurt their kidneys. But so they'll get several of those during their puppy vaccines. We also like to give the influenza vaccine. They'll get a couple of those during the period. They'll get a Bordetella vaccine, which is an upper respiratory condition that's really common in dogs. And then they'll also get a rabies vaccine.
And at what point do we start administering heartworm and flea stuff?
Heartworm is pretty early. 6 weeks is when we'll start that, if not earlier. The flea and tick prevention, most of them will have a start time of around 4 pounds and 8 weeks of age.
And can you explain the whole heartworm thing? Because I don't think anyone out there even knows what heartworms are and how they can affect your animal. Because once they get heartworms, they're pretty much done. It's disgusting. But explain just how important it is to make sure that your pets are provided for when it comes to heartworms.
So heartworm prevention it's a monthly. There's several different preventions that you can use. So you can use a monthly prevention that's oral. There's also topical preventions. There's injectable preventions, which last anywhere from 6 to 12 months. But they're not. If a pet gets heartworms, they're not done. It can be fatal. It can kill them for sure. But there are treatment options, and it just depends on how long they've had heartworms. The longer they've had it, usually the more damage on the heart. Probably the more risky treatment is, because they're compromised. But the way that you treat it is with a medication that will kill the adult worms. It's an injection, and usually they'll get several of these injections spaced a certain time period apart. And then you'll also go ahead and start them on a heartworm prevention that will keep them from getting more worms during that time. You have to, so when you kill heartworms with the injection that I'm talking about, that can cause an infection that's called Wolbachia syndrome. Mm-hmm. So the worms die and they cause an infection in the body. So we try to preload the body with an antibiotic called doxycycline so that when we do start killing the worms, they will not get that infection from the worms dying off.
Heartworms are absolutely disgusting, man. I'm looking at pictures of them right now. They're disgusting. They're gross. I wish it upon nothing or any animal for sure. Dr. Rab Stewart, Rossbridge Animal Hospital is where you can find him, 205-208-0301, brought to you by Ed's Pet World down there in beautiful Homewood, and we greatly appreciate their patronage and, of course, their sponsorship here. And, of course, you can find him, again, 208-0301 at Rossbridge Vet on Twitter and, of course, the Rossbridge Animal Hospital on Facebook. Jessica in Houston wants to know, what's the most kittens that Dr. Rab has ever give birth to at a store?
Oh, me personally, I've never given birth to any kittens.
It's not what I heard.
Thankfully. Yeah. We have only had, in my practice, we've only had one litter of kittens, and there were only 2 of them. And this was like when we had first started, and a cat came in, it was having trouble having the kittens. So we had to do a C-section. So most of the time cats are really, really good about doing their own thing, and not needing a veterinarian. So my answer is really boring, and it was only a litter of 2, which I guess is actually, like, in our world, maybe not so boring, because you would expect the litter to be a lot larger.
Now, we've had the birth of pups in our home, and we brought Maxie in, and you did an x-ray of her and an ultrasound, the whole 9 yards. We knew how many pups she was going to have. Dogs pretty much self-sufficient, pretty much know what to do. And how is the male associated with those pups after they're born?
The males are pretty much out.
They're deadbeat dads, huh?
They're pretty much out. And they're not, they're just, because most breeders, well, I shouldn't say this. Most breeders that we see do not have both the male and the female. They have the female, and then they have a friend who has the male, or, they pay to breed with a male. They don't have both the dogs. So the male has his fun, he does his thing, and he never even sees them most of the time.
Is there a special relationship there between those 2 dogs if they live together? Because like Frisco mated with Maxie, and now they live in separate homes. But when they see each other, I don't know if they go, "Hey, I remember I mated with you once. We had puppies." Do they sense that they actually mated at one point, or is that like just no?
I think they probably do, but I think that they, they're very. Their instincts take over, their hormones take over. And I really think they're just all about the business, really. I think that they're more about, okay, nature is telling us to do this, let's do it.
Yeah. I'm going to name my next dog Nick Cannon. Dr. Rab Stewart joins us here at Darkside the Pooch. We run it every Monday here at noon and 8. You can hear it on Spotify. Go to Spotify if you enjoy what you're listening to, and you're one of the hundreds of people that send us emails all the time. For gosh sakes, go to Spotify, search Darkside the Pooch or Tony Curry Radio, and listen to the shows. They're fantastic. Skip in Atlanta says, doggy bags used to be something you take home from a restaurant. Now we're walking around neighborhoods with these little green bags picking up our dog poop because the neighbors are getting pissed off because there's dog poop in their yards. We never used to do that, and I understand why people do that, and people spend lots of money on their lawn and their landscaping. I get that. He said, but why do some animals have very acidic urine where it actually stains the grass, and Poop does that too. And then some dogs don't. Sometimes it just sits there, turns white. You can kick it. I don't pick up my dog's poop. I mentioned I've got my poop shoes where I just kick it onto the street. But why do some animals have more of acidic fecal matter, if you will, and urinary issues?
Because that's just the way the good Lord made them, I guess. And we talked about it earlier, the bladder stones. This is the dog's natural urine concentration and pH. That's just the way that it goes. And it can, as far as the urine goes, concentrated urine will kill your grass more than dilute urine will. So your dog may not be drinking enough water if that's happening. But also it's the way the dog makes its urine. And sometimes the best way to alter that is to change their diet. There's a lot of foods that target pHs of the urine and try to cut back on crystal formation and stone formation and bacterial infections within the bladder. So those are all things that play into it.
I just got a post here from someone that says, "Let your Pooch into the dark side with this Darth Vader dog bowl." It's a Darth Vader dog bowl. I bet you that's something they have down there at Ed's Pet World. Darth Vader dog bowl. It's a water bowl. It's pretty cool. It's got the buttons on it, and it actually is self-watering. It's pretty cool. Something to think about. Darkside the Pooch here with Dr. Rab Stewart from the Rossbridge Animal Hospital. The number is 205-208-0301. So check that out. It's great. I sent you a video earlier this morning of a dog that learned how to do hopscotch. Now, we've talked about how smart animals can be, and we've talked about how brilliant they are. They can find toys. You can put names on toys. They know exactly what to find. What is it that you cannot teach a dog? If you will spend enough time trying to teach an animal how to do hopscotch, is there anything a dog won't do?
I can tell you what a dog will not do.
Ooh, I want to hear this.
A dog will not resist a bag of hamburger buns on the counter while you're at work.
Yeah, you think so?
You cannot teach a dog to resist potato buns.
Yeah, that is, the Hawaiian buns are pretty good too. Do you sometimes, have you ever set your dog up to see if it'll actually go for it? Is that a bad thing for an owner? I mean, if you discipline your dog enough and you just want to see if it'll push the issue, have you ever tried that before?
I just want to let you guys know that if entrapment is not, that will not hold up in doggy court.
Yeah, we talked about
can't do that.
We talked about this on the last show because I mentioned to you, I mean, you discipline an animal, it knows what it's doing is wrong. Do dogs know when they're doing things that are wrong? And your answer was?
Yes.
Yeah. I mean, they're just like kids. They will push the issue. They know it's wrong. Now, if you're talking about leaving, and I tell my kids all the time, because if they don't clean the table off when we're done eating dinner and we all go in the other room, both my dogs will be on the kitchen table, walking across the kitchen table, eating everything off the plate, and it drives me crazy. I'm like, you got to clear the plate, because if entrapment is a nasty thing. You do not want to be doing entrapment, because you can't do that to an animal, especially when it has something to do with food, for sure, right?
You can't punish them. It's like it's the same. It's the same with the law.
Yeah.
You can't entrap people. I never really understood that. I mean, it seems like you should be able to do that. But then again, I'm not an attorney or a judge. I just play with dog poop for a living.
It's kind of like making your husband go to a strip club. It's a bad idea. Dr. Rab Stewart. Don't do that. Dr. Rab Stewart, he's got a barking dog behind him right now, so we're going to let you fly, man. Thank you so much. Anything else new going on in your world?
No, you're just saving the world, one bladder stone at a time.
There you go. You're the man. I greatly appreciate you, man. Thank you so much. We'll talk to you soon, of course. It is the Rossbridge Animal Hospital's Darkside the Pooch, brought to you by Ed's Pet World. Ed's Pet World's been down there in Homewood for over 50 years. I just went there earlier today. I got me a big fat rat from my red-tailed boa. They've got all kinds of great stuff. They got caiman alligators down there. They got red-tailed boas, lizards, geckos, chameleons, bearded dragons, birds, parakeets, Amazon parrots that talk, chinchillas, ferrets, rabbits, It's unbelievable. And, of course, all the exotic pets, they will make sure they're healthy, and they'll make sure that you do everything they can to keep those exotic pets healthy. They also have an amazing collection of vintage and modern toys. Seth goes around the world looking for his passion of collective vintage and modern toys. Come see their collection of figurines, pops, Star Wars stuff, various items, especially watches, collectibles. They buy, sell, and trade. So check it out at Ed's Pet World. Their number is 879-1331, 879-1331, or just go down to Homewood. You know you want to go, and the kids love Ed's Pet World. Dr. Rab, thank you so much. We'll catch up next week.
Oh, wow, baby.
This has been a special presentation of Tony Curry Radio.